Hello, I'm Dr. Daria Brzezinski, and you are watching What Wize Women Want here on Charlottesville's Public Access Comcast Channel 13. Every week we bring you panels of women on topics that we think will be of interest to you. Ladies, we're 52% of the population with 85% of the purchasing power. Let's use that power by making informed choices about the things we do for ourselves, our families, and our communities. You can go to our website at www.whatwizewomenwant.com if you'd like to find out about future broadcasts or past broadcasts. There you will also find the panelists. Each panelist has a page of her own on our website where you can find more information and contact information. If you'd like to submit a question for future broadcasts, you're welcome to email us there on the website, and we will ask your question on the air. Today we are going to be talking about children and prescription drugs. Hot topic, since we have millions of children in the United States and around the world who are at younger and younger ages being prescribed drugs, what those effects may have on children. Today we're going to have a physician and women who are going to be a lady especially who has gone through being prescribed as a child and the effects it's had for her as an adult. To my right, we have Debbie Crosby-Louis, who is owner of DLC Image Consultants. To her right is Carter Lewis, who's the founder of RitalineAwareness.com. And to her right is Dr. Pamela Ross, who's founder and CEO of Holistic Medical Consultants. Okay, ladies, there are so many, in my profession, there are so many children that I see who are on prescription drugs at earlier and earlier ages for ADD, ADHD, and for what I consider to be behaviors of children that are normal. So let's talk about that. What is your experience, Pamela, with prescription drugs in children? Would you like to summarize that a little bit?
Sure. Well, very much like what you see, Daria. In my profession, I have two careers, one as a holistic practitioner of medicine and one as an emergency physician. And that's where I interface with the most amount or the highest number of patients that I see. So certainly I see a lot of kids who are on all manner of prescription drugs for things anywhere from bipolar disorder to depression to ADHD to schizophrenia. And I often find myself wondering at very young ages. I've been in the practice of medicine for about 20 years now. And what I can say is that over that time frame, I'm seeing children with diagnoses that used to only occur with adults. So it's definitely becoming more prevalent, just as you've observed.
Carter, what is your experience, briefly, for this introduction?
Yes, I was placed on Ritalin at the age of 6, and I was placed on it because my intelligence level did not meet my performance in school, and there were some socialization issues that were observed. And my experience is that it has had a lasting negative impact on my mental health. I deal with very severe depression because of it, and we can certainly talk about why that is as we go along.
Would you mind tell us what your age is?
Yes, I'm 29.
And you were put on Ritalin when you were how old?
I was 6.
Okay. Debbie, wow. What's been your, why are you on this panel? What is your experience?
And I am on, particularly as a parent, concerned about this. My kids are fine, though what I saw in the last year, my first daughter is off to college. And within her last high school year, it was so intense. And she kept coming home and talking about her friends taking this or this for anxiety because she's anxious. She's on this drug and on that one. And should I, meaning my daughter, should I be on that too? And to reference what Carter said about your intelligence level, that was part of it. Because one particular issue, and this is why I'm here, is a friend of my daughter's also, that was the issue. The parents said, look at how great you're doing on your exams when you're on the drug.
Ah.
And when you're off, you're not doing. I think that's berserk. It should not. Of course, my daughter didn't go on any drugs because it's something I can work through. Yes, it might take longer. And my position is, sure, we need integrative medicine. I'm not saying that, you just totally ignore that side. Probably there's some people who might need that, yes. But I think we need to be patient and take the time to work with the kids and grow them and nurture, because it's, I think it's just normal behavior that's being treated.
Sure. One of the things, based on what Debbie said, one of the things that just really has struck within me is that as a society and as parents of children in our society, I think one of the most crucial things that we all need to do as parents and as society is we've got to learn to love our children for who they are. We need to learn to love our children based on their intelligence scores when they're not on the drugs. That's okay, because that's our child. And I think that that's a very crucial thing that just, I don't know exactly what it takes, but if I have to say one thing that I would love to be the take-home message as parents, families, we've got to start to love our children for who they are.
Well, many of the children I see who are tagged attention deficit disorder, I began a long time ago telling parents, these are children in need of attention. That's their deficit.
Yes.
When my children were young, everyone said, oh, they won't sit very long, to hear a story be read. Or my children would sit at 4, 5, 6 years old for an hour and listen to a story, or work with their Legos for hours at a time. And I think, why do people say children don't have a long-term attention? And I think what you're saying is true, but also the expectation of children these days to sit quietly in school for hours and hours and hours at a time and not move or even respond or communicate or talk or have exercise. I mean, we're taking away gym now and recess and music and art and gym.
Yes.
And, in respect, we're drugging children into complacency to behave, and yet we have a 19th century model of education. And then we have children who we're putting into early daycare. They don't behave in daycare. I'm not even sure they should be in daycare and should be bonding with their parents, as you said. And here we are, drugging them because they are not behaving, quote unquote, whatever normal is. So what's the science behind, giving children? I mean, I don't know what ADHD or ADD is scientifically in order to be able to diagnose and prescribe. Is there such a test?
There is no test for ADHD, unlike my ability to do a swab and diagnose a condition like strep throat or draw blood to check for certain conditions in the bloodstream. There is no test. Something as simple as placing a thermometer and knowing exactly what a child's temperature is. We do not have that measure for conditions like ADHD. It becomes more of a conglomerate of assessments, and once the child meets a certain number of those assessments, they are placed in a category of being likely to have that condition. And the diagnostic criteria for Americans are different from the diagnostic criteria in France. Here in America, we've got about 7% of children who meet the diagnosis of ADHD, and in France, that number is 0.5%. And a part of the definition for ADHD has to do with it is within the realm of normal for that child's age, sex, and behavior. And it seems that here in America, perhaps we have a very narrow perspective for what normal is.
I would say so. There's a part of the brain that isn't fully developed by 6. It's not fully developed by 25.
Right.
And that part of the brain is responsible for any symptom that's related to ADHD: attention span, ability to follow through, ability to work for reward, any number of these behaviors, ability to control hyperkinesis. And this part of the brain has not even finished developing.
That's right.
And the fact that we're drugging for a part of the brain that, I mean, it makes no sense.
What part of the brain is that?
That part of the brain is called the prefrontal cortex. And there were children, additionally, there was a study done by the National Institute of Health that found that children with ADHD, they were 3 to 5 years behind in some of their prefrontal cortical developments, but that they did normalize. So these are children that, in some cases, if we wait and see, they will normalize.
We call that slow learner. Than everybody, that's what disturbs me about what you two said about giving people drugs because their intelligence level or they did better on tests and things of that nature. Yeah. The fact that we're measuring children's intelligence by, everyone has a different level of intelligence, and as well, they develop differently.
That's right.
Everybody has everybody isn't a college material. Some people like to work with their hands, they're just not college material.
Right.
That we are categorizing these children's behavior. And, we don't want people to be rambunctious, and then all of a sudden they get to be adults and all the corporations are saying, why aren't people creative anymore? Why aren't people multi-talented?
Absolutely.
It's because, we're drugging them.
Right.
So Carter gave me and gave me permission to read some of the things that were on her neurological evaluation. And the reason I'm reading this is because I have found in my practice that many of the children who I've seen on psychotropic drugs display some of these behaviors. And I wanted to read them to you so that in the event that your child is eliciting these behaviors, may something have to do with having taken Ritalin. She had particularly planning and judgment, as well as reduced complex attention and working memory. She's having difficulty pulling pieces together while doing a task, working memory difficulties, feeling easily distracted and starting things that she doesn't finish, as well as planning ahead, depression and anxiety, and sleep issues. And I see this time sensitivity to light. And so I see this time and time again with children who are on these and all of a sudden develop. But I think the thing that I see the most is this flat line of behavior. There is no passion. There is no, excitement about life. It's just this flat kind of response.
And there's a word for that too, if I could just go a little further. The word anhedonia means lack of ability to feel pleasure. And that is that void of experience. And by pleasure, if I were to just define that for you, it means if someone gives you a hug, normally that elicits a warm feeling, a feeling that feels good. If it's a bright, sunny day, there's some level of enjoyment. I'm not even talking about large levels of enjoyment. I'm just talking about everyday things. I don't feel any of that at all. And everyone that I've encountered who is placed on the drug as a child does not feel that either. And part of that has to do with a neurochemical called dopamine. It's responsible for attention and it's responsible for pleasure. If you boost that long enough in certain levels and you're overworking that circuit and the brain stops producing that chemical on its own and you end up with depression. And there have been studies that have shown that animal models that anhedonia does occur with doses of Ritalin, the same doses that they give to children at the same equivalent ages that they give to children. So this is a huge problem.
Yes.
I have a question for you, Carter. Yes. Talking about dosage, do they know? Because this was one of the questions that came up when I was working with my daughter, and hence the reason I started doing this and reading more about the brain and working with work from Dr. Tansey at Neuroscience and Harvard. Do they know really what dosage to give Do they know, or do they guess? Okay, you're sick, so can we give her this? Do they know what's happening?
They guess, but part of the problem is that some of these children, and stop me if I'm getting too complicated, and I am one of these individuals. I have a reduced capacity to clear medication because of enzymes in my liver that are operating more slowly than others. Now, someone might say, okay, well, this happened to her because she had a reduced ability to clear the drugs. Unfortunately, a lot of people who might be dealing with issues like attention deficit disorder might actually be dealing with a reduced ability to clear toxins, to clear, these sorts of things. So one of the problems that happens is that not only are you giving someone a drug that may be inappropriate, they may be naturally not able to even handle that dosage of the drug. And you can test for this genetic abnormality and they don't. I had genetics testing later that found it.
Well, I just heard studies recently about, the difference between just men and women. Correct me if I'm wrong, when they test prescriptions, they generally test them all on men. And now it's coming out that there's a very vast difference between men and women and the dosages they can tolerate. But also, correct me if I'm wrong, aren't these prescription drugs tested on adults, not children?
In most instances, yes. Almost 100% of clinical trials that occur for pharmaceutical drugs occur in adults for many reasons. Number one, adults are able to give consent. Children are not. Number two, you don't want to really expose normal, healthy children to some toxic drug just to see what the outcome is going to be. So there are a lot of reasons that the children are not included in clinical trials. I actually think that's a good thing. But what happens is the data from animals gets extrapolated into adults, and then the animal data comes out as testing in human beings, and those usually are adults, and generally they are adults who volunteer. Very often, that's more often men than women. That's more often majority populations as opposed to minority populations. And so then you get some idea of how the drug works in certain subsets of the population. And then from there comes an extrapolation for how to dose it for everyone else, including children. And that is very much a guessing game. And the dosages get set. They are given to children, and based on the outcomes or results or side effects that start to roll in, then things start getting adjusted. I think we have a classic historical example for this in aspirin. All right. We know that aspirin is a great drug. Now we know it's a great drug. As a woman who may be having a heart attack or at risk for stroke, we know that there are clinical trials that say aspirin is great. But what we also learned about aspirin is that we took those adult doses, we made some adjustments, and we started using aspirin for children when they were running fevers. Then all of a sudden, we started seeing children with a diagnosis of a condition called Ray's syndrome, which ruins the liver and causes seizures and affects the brain. So a lot of this is related to not knowing, and we have to be very careful, which is why I certainly advocate for a very holistic approach with our children when we're particularly with behavioral issues and non-measurable diagnostic conditions. I would say, hey, let's change the diet. Let's make sure we're maximizing the atmosphere of the home. Let's make sure we're addressing our child's needs, mind, body, and spirit. Let's make sure let's add a multivitamin a day. What they don't need, they'll excrete, but if there's some trace mineral that they're not getting, we can address that. Let's do all of those things first before we go into the realm of these drugs that we've got research that shows in mice. When you give those drugs to little developing mice with their developing brains, and Carter has already said that our brains don't finish their development until we're about 25. We already have the evidence that says those drugs interrupt the neural circuitry of the developing brain. And so the other thing that we have to wait and see are what the real outcomes are going to be.
And it's a shame that we're waiting for all these generations of children before. I've said this before on previous programs. You know, when I was in school in the early days, in the 50s, the Dairy and Cattlemen Association brought us these, the food pyramid. You had to drink 3 glasses of milk a day. You had to eat all this meat and fat, and there was no scientific data behind it. It was just a classic example of corporate marketing in the schools. And what did they do? They took all the kids to the farm. You know, you learned how to milk cows. You went to the ice cream. And everyone was hooked on drinking dairy products. And here we are, you know, then 50 years later, finding out we've got all this fat in our diet that's not healthy. And that's what my fear is about these prescription drugs. You know, we've got generations of children who are going, and I think the reason why people do it is because it's a quick fix for an answer.
It's a Band-Aid.
I've also seen parents who think it's a badge of honor that their child gets labeled and gets drugged. And I know that sounds awful, but I've seen it over and over again. Oh, great, my child has a label, you know, there's a reason for this behavior.
Yeah, sure. Psychologically, that's a whole lot easier to deal with than the question of what's wrong with my child.
Right. Yeah.
What's wrong? And then I think the other thing that we have to learn to do is stop asking ourselves what's wrong with our children.
Exactly.
What's right with our child?
Exactly.
What's good about our
Exactly.
child? What gift does our child have to bring? You talk about intelligence, and, you know, we've got one good, I won't even call it good. We've got one way that we measure intelligence in society and in children. And it's just such a narrow way for seeing the world. Intelligence is not just my ability to do math or pass an exam.
Right.
Intelligence is my ability to engage. Intelligence is my ability to see 50, 60, 70 different shades of blue in that background. Intelligence is so much more than just sitting and taking
And this is why it disturbs me that, you know, they drugged you over intelligent, you know, that you were slow.
Well, we're talking about several different learning styles in one classroom, and you know, individuals who don't comply with the learning styles that the classroom has to offer become the problem children. So, for instance, I had some light auditory processing issues as a child. I'm very visual and very kinesthetic. So, you know, anything that did not cater to those
The way you learn
would have been an issue. And, you know, I think that's part of the problem. It's, you know, not catering to individualization, not seeing the beauty of individualization. And then something that you said inspired me in a thought. As we were talking about measuring ADHD and so forth, and I feel like parents get pressured to put children on medication because they're told it's like having diabetes. This was always the thing that was said over and over when I was growing up is, well, you wouldn't deprive a diabetic of medication. And that is just so far from what ADHD is. You can measure diabetes. We know what the mechanism is there. We know how to treat it. The mechanism of ADHD could, if there is a legitimate issue, could be a variety of other causes, you know, or it could be a non-issue that is just regular childhood behavior.
To piggyback off of some of this too, and what I'm hearing is, and those are the questions and the things that is in my mind, it's taking the normal kids, for example, and I'm from Trinidad and Tobago, and our culture, and I look at it here and I say, oh my, half the boys, more the boys in my class in Tobago would have been on drugs had they not been in Trinidad and Tobago if they were here, because they're not the normal behavior. They're in the classrooms, but they can't do that. So what did they do? Well, they took them and they did woodworking and they did other things. You know what? Years later now, they're successful men, they run companies, they're great dads, they're husbands, they're normal. What's supposed to be normal, they are.
Exactly.
So can you imagine in a different setting, these very kids would have been treated.
Drugged.
They would have been drugged.
And I think what that brings is the society acceptance for what's normal. It makes all the difference in the world, you know. And I can, you know, my heart goes out to the children. My heart goes out to the parents, because I'm certain that there are a lot of parents who don't necessarily want their children to be on those drugs, but often have no choice. You know, now it's a requirement of the school systems. I'm inspired by a cartoon that I recently saw posted, where there's a sign in front of the school, the big sign that says, "Drug-free school zone." Big, huge sign in the front of the school. But in the background of the school, going through the back door, is this huge truck unloading a big thing of Ritalin. And you know, and it boasts about being a drug-free zone, but you know, it's for, you know, in defense or in compassion and understanding for the school system, they have certain goals and standards that they have to meet, that they're not necessarily in control of. So it becomes like this incredible spiral out of control about what's normal. Parents who want to accept their kids as normal get told by society that no, there is something wrong with your child. And then all of a sudden, there's all manner of justification for how and why that child can be systematically mistreated, such that they become outcast of society. And that's very sad.
And labeling does that as well. And I've been called in as an expert on occasion to talk about when a child's behavior is disruptive. And you walk into those meetings and it's the principal, the vice principal, the nurse, the social worker, all the child's teacher sitting around in a circle attacking the parents and telling them they're the problem. You know, your child is a problem. You need to take him to a psychiatrist and get him drugged. So parents are pressured in many occasions.
Lots of pressure.
Lots of pressure.
Yes. By the schools themselves, who really are part of the problem, because they're the ones who need to get out of the 19th century education model and into the 21st century. And we're trying to make children who are creative and intelligent and bright adhere to this old model that doesn't exist anymore. And what are we doing to our children in the process?
Yes,
so
I agree.
I'd like to remind you that you are watching What Wize Women Want. I'm Dr. Daria Brzezinski, here on Charlottesville's Public Access, Channel 13. And you can reach us or take a look at our program and all of our panelists on our website, www.whatwizewomenwant.com. And remember, Wize is spelled with a Z. That's www.whatwizewomenwant.com. Today we're talking about prescription drugs in children. On our panel today, to my right, is Debbie Crosby-Louis, owner of DLC Image Consultants. To her right is Carter Lewis, founder of RitalinAwareness.com, and Dr. Pamela Ross, MD, who's founder and CEO of Holistic Medical Consultants. So, are we at risk as a nation with having, I mean, we just had a discussion earlier about my attending funerals of people who committed suicide who are on several different psychotropic drugs for depression and other kinds of things. And I've also studied school shooters. And every single school shooter has been on at least 2 to 5 psychotropic drugs. Are we at risk as a nation, you know, for this kind of behavior that's, I mean, we're now in the 2nd and 3rd generation of prescribing these kinds of drugs. What's happening to our, you know, is it altering our genetic code, or what's happening here?
Well, my biggest concern is that these drugs are getting a free pass, because what's happening is when someone commits a murder, when someone commits suicide, when someone, even like myself, comes forward and says, I have depression and all these issues because of medication, the first thing people are going to think is, well, she would have had that anyway. That's probably why she was on the drugs. Like, these children shot up a schoolyard. That's probably why they were on the drugs. And so the drugs get a free pass, and no one ever looks at their role. I mean, there is, there's research, but it doesn't come forward into the limelight because everyone just wants to go ahead and assume that that's why.
And one has to dig to get that information, by the way, because it's confidential information. But that information is not given to the public, and most people don't know it unless you're able to be privy to that kind of information. But that's right. I mean, I had a client who was the picture of health, lived for his grandchildren, and had a blood pressure problem, and the physician gave him 3 different psychotropic drugs, and 2 weeks later he shot himself. So, and nobody attributed it to the fact that he was on the drugs. I mean, this was a man so full of life, it was amazing.
Well, we certainly have the evidence now that does speak to the increased risk for suicidal ideation and suicidal behavior, particularly at the onset or in the early parts of starting some psychotropic drugs. So we do, that is very, as a physician, perhaps I do have more access than the lay public, but we do have that information. And to your question about are we at risk as a society, the risk is here. The risk is manifesting. The dangers of what we're doing is manifesting. Yes. The pharmaceutical industry is a multi-billion-dollar industry. They succeed because there is a demand for their product. Right. The great thing about being in America, if there's no demand for your product, you're not going anywhere. It's just not going to fly. So, it gets to be a very, very entangled, murky, gray, where is the problem exactly? I think we have to take a multifactorial approach and when we look at the problem, but the risk is here. The danger has already been imparted on our children. The perspectives have been set. I think that the risk to children is real. I applaud Carter for just her courage, her insight, and her gift to bring this awareness. I think that's another thing that as a society that we have, we don't like for people to know what's going on with us. That's right. Just to be open and transparent enough to allow someone to read from my medical record about me takes such incredible bravery. And I think that's another problem with our culture. We're so secretive that as opposed to being open about what's really going on with us, we want to hide it. And in the end, that makes the problem even that much more significantly worse.
Well, I had told Carter when I first met her that she was the most articulate person I had ever met on Ritalin in my entire life. And I've been trying to give her a voice ever since. Carter was a little luckier than most because her parents, although drugging her at an early age, put her in talk therapy, which created this articulate human being. Normally, I have such difficulty with people that flat line or, just have no passion about anything and are unable to speak about the way they feel as well as Carter does.
She's incredible.
Absolutely.
She's absolutely incredible.
It's a refreshing, it's refreshing here because, like Pamela mentioned, that's something I saw. A lot of the parents of these kids, it's hidden. They're not open to speak. When I came out, I'm saying, well, my daughter said she's anxious. Oh, well, I have. It's a secret. And everything is a Band-Aid. It's something that I see. They take the problem, and you know what? Let's take care of that. And that's what I think is happening. That drug, it works as a Band-Aid. It helps to mask the symptoms.
Yes,
absolutely.
Symptom suppression
exactly
is what they're looking for. And unfortunately, I don't even think the goal is necessarily optimized functioning in schools. I think that the goal is symptom suppression. We want these children to stop being hyperkinetic and to sit still. And unfortunately, that is deemed as successful treatment. When they see symptom suppression, the treatment is deemed as successful. It's not about whether the child is happy. I was immediately showed symptoms of depression beginning the drug, and I guess I'd like to paint a picture of myself of who I was before that so that people don't just assume that I was born as a melancholy child. I was vivacious and happy, and I was the kid in a row of ballerinas where everyone's sitting still and I've got my tutu over my head. That was me.
Right.
And unfortunately, that was not what school wanted. So the success was that I was suddenly still and I was obedient. The success was not that I was happy.
Right.
And I think that's very unfortunate.
That's right. And it reminds me of another very valid medical historical example. And you have to forgive me because I'm blanking on the gentleman's name, but there was a doctor who specialized in Icepick Lobotomies. All right, it became
I know who you're talking about.
Do you know who I'm
Yes.
talking about?
Yes.
So all of a sudden there was this thing about, okay, so you take an ice pick and you put it right here and you knock it in and you scribble it around and it makes them behave so much better. So this took off for that period of time in medicine. That was the rave. That was the thing that a lot of people were doing. And it was brought to my attention recently because there's a man, probably in about his 60s now, who had that done to him when he was a child, and just trying to come to terms with that process. So now here we are in the year 2014. As a physician, I can say that is absolutely the most absurd. How could they ever? What were they thinking? Yes. How in the world? And I think that there will be a time, I may be living, I may not, where we will be saying the same thing about these drugs. Because what these drugs are they're pharmaceutical ice picks.
The mechanism of action is almost, it's very similar to cocaine. There's hardly any difference.
Right.
And in fact, they found that it's more intensive than cocaine in certain areas of the brain. It's the dopaminergic release is similar to methamphetamine. So these drugs that we're outlawing, they're coming, it's like the cartoon, they're coming in the back door as
valid, legitimized prescription drugs.
Right.
The pharmaceutical industry, they are our biggest drug dealers now.
Well, what I've discovered is that, with the clients that I've had who have been on prescription drugs as children, is that they have never developed coping skills or developed the kinds of skills they need when it comes to adulthood, just to function.
Right.
For example, they don't have discrimination and discernment skills of who's going to be a predator, and then they become prey, or they have boundary issues where they're constantly they'll be in a grocery store and they'll constantly be in somebody else's space because they have no concept of what space is.
Yes, it puts you in your own little world. That's
Right.
how I felt like when I got on the drug. I felt like when I was off of it, I was out in the world, I was engaging with the world. When I was on it, I was less hyperkinetic because suddenly my brain was sped up so fast that I became internal and went into my own little world, and it didn't cause me to really develop a relationship with my world.
But you had thoughts of suicide.
I would say beginning at age 12, there's the initial melancholiness that came with just administering the drug. The light went out of my eyes was what family members have said about me. And then around age 12, I couldn't figure out why I was losing interest in things once loved. All the hallmark symptoms of depression, but I didn't know what it was because I was 12.
But you see it with the timing of it, it's prepubescent. And when the hormones are changing. So these kids who have been on these drugs, once they start going into puberty and the hormones start changing, then their behaviors start changing and they're looking for another drug to be able to compensate for it. And I see that as well. All of a sudden now the drug isn't working. And frankly speaking, a lot of the rage and the emotions that have been cooped up and been sublimated are now exploding all over the place because the drug is no longer effective.
Yes, because also the drug is, think of someone on cocaine and think of an adult on cocaine. These people are unbalanced oftentimes. And so then you put you've got a teenager on cocaine. That's essentially what Ritalin is doing.
Right.
So then you get all this emotional imbalance, then you get additional drugs added. When I got off of Ritalin, it was like I was a new person, and I had to get to know myself all over again, because my whole life I had thought that I was one person. I had thought I was this moody, irritable, just all of these things that weren't me. And I think that's another horror, is I lost 12 years of my life not knowing who I was and not knowing the real me, and that's a great sadness.
The prescription drug companies cater to physicians all the time in order to be able to sell their. I mean, we see all the ads on television now. I mean, it's just insanity. But and also they tend to go to. I mean, I know personally many physicians who tell me that the drug companies come in and serve lunches, every day, and then tout their new drug, or give free samples, or fly physicians all over the place to, give lectures and talk at conferences. Is that really true?
Well, fortunately, there have been some laws as relates to ethics and things of that nature that have eliminated a great deal of that type of behavior and relationship between drug companies and physicians. But what you say is very historically accurate, where drug companies would give lavish gifts to physicians and do all manner of things and teach them about their drug. But what we found, or what was clearly evident, was that the more physicians received from the drug companies, the more those drugs would be used. And so that certainly raised some ethical red flags about what's appropriate for the behavior of physicians. We now have some pretty ethical, solid guidelines, laws in place that prohibit a lot of that behavior. But the other thing that you mentioned is, and here's where the physicians get in the quandary. Now that you're seeing commercials on television, that means the physicians are being bypassed now. Right. Now that you're seeing the commercials and you're seeing the pretty pictures of the women skipping through the fields with all these bright colors and life is great, and you're hearing, but you've got the visual imagery, and then you're hearing something about can cause heart attacks, decreased libido, sudden death, but you're not hearing that. You're visualizing that, and you're hearing all the great things that it does. And here's the predicament that I often get in as a physician. Somebody has seen a commercial on TV for some symptom that they're experiencing, and they'd like me to write a prescription for that drug. Right. And then it becomes a matter of taking the time to have a conversation with the patient about why or why not that drug is or is not a good idea. And now we've got a system where physicians are held to patient satisfaction standards. So we've got a society that, we've got all types of drive-through where I can go almost anywhere, drive-through, place my order, get what I want, and then just drive right off. And we're trying to apply that mentality to medicine, and that's not the right mentality for medicine. So physicians sometimes...
Or you can go online and get it from Canada or Mexico.
Absolutely, absolutely. The world is getting smaller. We're definitely more connected to many other places, but
your point is that anybody can get those things from anywhere, anytime, any place. The sad part that I see with that access is the fact that the children, I've been told this even by my own children, that all these kids go into their parents' medicine cabinets, and then have pill parties where they pour the pills into a big bowl and everybody takes a handful and takes a few pills prescription. So now we've gone to another dimension in terms of children and prescriptions.
Yes,
it's creating a new type of addict, and it's creating a socially acceptable addict. That's what it's doing. The prescription drug industry, abuse in the prescription drug industry is so much higher than what we call the hard street drugs. We're seeing more and more levels of addiction from prescription drugs. We're seeing more deaths from prescription drugs. It is the socially acceptable form of addiction now.
Well, one of the things that I remember in my childhood was that my brothers, now we're not even getting into these, psychotropic drugs, but when I was young, my brothers had acne. And they were all prescribed, thank God I wasn't, tetracycline for their acne. And all of them had yellow teeth within a very short period of time, and had, before they were even 18 years old, all had to have capped teeth. And so, the fact that the kinds of prescriptions that are being prescribed for acne, for goodness sake, and all these other forms of things it's not just the ADD and everything else, but it's, for the most minor of things.
Well, it's for me, it's the quick fix, and that's why I'm here. It's as a concerned parent, and I just think we need to take the time. Like Pam said first, she's mentioned loving your children and taking the time. I think what has happened as a society, it's so fast paced. Everybody wants this now, and yes, I can help my kid with her anxiety. But it's not going to be overnight. But they want overnight, they want to be diagnosed with something. So it's like you said, it's better to say, yes, they have this problem. Yes, there's medication for it, and take that. In the meantime, you don't have to. I personally know you don't have to. I walked right through it with my daughter, who's fine. And now she's in college, and her friends are calling from college at 2 a.m, mind you. And 3 a.m, I feel anxious. But the great thing is they're calling, Mrs. Louis, can I talk to you? I feel anxious. And we go through, I get up, and we go through the deep breathing, and we start pieces. We talk about your mind being in charge of your brain,
right,
and not the way, and have that work, and just start seeing it and training them to cope.
Exactly.
They're afraid. Everybody, they're afraid of something, and we teach what that fear is and how to tell it go away and all this stuff. It's just that it takes some more time, but I think as a society we don't have that. We're not giving that time.
That's exactly right.
We're not giving
it's our
that
choice
time
to take that time,
and that's true of every aspect from the time their children are born.
That's right.
It's hurry up, so let's have a C-section, and
yes, that's a whole different topic.
To put children into daycares at 6 weeks.
Absolutely. But it speaks to what the society values. Sometimes we often look for the source of the problem outside of ourselves, only to find that we ourselves are the problem. And we really do, in order to make these sweeping changes that we need as a society, it doesn't start at the global society level. It starts at the level of each individual. And like I said, a multi-billion-dollar drug industry could not exist if the demand for it were not present.
Well, they've got the perfect demand. I mean, they've taken a part of the brain. They've taken a part of the brain that is not fully developed, and they have, so they've got a built-in market for this issue. I mean, if you think about it, it's the perfect plan.
Yeah, let's take normal behavior and medicate
consumers.
It. Yeah,
exactly. And it's just, even with the delay, even with children who are experiencing legitimate issues of hyperkinetic and attention that are not on par with their peers. Again, there's the study from the NIH, 3 to 5 year delay in these children. They do normalize. Giving them a pill would be like someone not being tall enough. At the same age of their peers, and let's give them growth hormones. It's that.
That's right.
That happens.
It's that problematic.
It's the same. Yes.
And I just want to get back to something you had said as well. I was thinking along the lines of even though the doctors are not receiving gifts, don't they receive direct information from pharmaceutical companies mailing and disseminating this information?
Yeah, we have access to all sorts, and that, as a physician, I find very useful. We get, take for example, I'll get a mailing anytime a new drug has been released, and I get mailings anytime there's a black box warning that comes out. But that is information about the drug itself. It's not associated with a gift or anything like that.
I was just wondering if they, from what I've heard from psychiatrists, it sounds like the drug companies will contact them to tell them, we have this great great new drug, it does this, it does that. And so even though the gift giving is removed, it sounds like there is still product promotion.
Absolutely, still product promotion. But I haven't looked at any studies for this. But when you think about human nature, I'm certainly going to entertain anytime there's something new.
Oh yes,
I'm going to entertain. I'm going to look at it. I'm going to learn about it.
Yes.
But I think receiving a pamphlet of information in the mail is a much more ethically acceptable way than to get a gift or get a lunch or be put on a plane to go somewhere to do it. But they do get the information out there. And what's happening now is that the latest and greatest drugs are being marketed directly to the people. They're bypassing the doctor.
I suppose, yes. I suppose I wanted to make that point to make this point. A lot of times I talk with parents about natural alternatives and they'll wonder why their doctor didn't tell them about it. And it seems to me that the pharmaceutical companies are, they have the funds and they have the drive to reach out to physicians to tell them about their product. Who's going to contact physicians about food allergies unless they do the research themselves? No one is going to aggressively make that contact to let them know, hey, did you know that salicylates, which is something that naturally occurs in plants, can adversely affect some children and cause behavioral problems?
I was going to say, and we haven't even gotten into the point where a lot of the prescription drugs, some of the foods you eat, like grapefruit, has a counter effect to the drug. Some of the foods that you eat have a counter effect to the many of the drugs that are in them. And nobody ever tells parents, when you take this drug, be sure they don't eat this, or this, because it has a reaction to the drug. So,
I think that physicians who don't do that, I just think that's where physicians fall short. It's certainly my practice to speak with patients about, again, the holistic approach. Looking at the person and not the disease, seeing the whole person, mind, body, and spirit, and creating a health plan that works for that person.
How do you do that when you only have the insurance company only lets you have 5 minutes to be able to work with a client?
So, that's a really good point, but the insurance company doesn't determine my time with the patient. I determine my time with the patient. The insurance company determines my reimbursement. And then it becomes an ethical decision that I get to make for myself. Do I take 5 minutes to see the patient, or do I take the time to create the healing relationship and find other ways to practice medicine in the way that I want to practice medicine? And that's a tough, I'm not telling you that's an easy decision to make, but there are some, there are certain things that I have to do with my life and my choices that allow me to rest my head on my pillow and sleep soundly. And that means taking the time to teach people about their bodies, about their health, beyond the control of what any insurance company or pharmaceutical industry could have over me. I'm still the master of my fate and the captain of my soul.
Well, it's wonderful to me, and this is why we have you on the panel today.
I think that's
because we know that about you. But the majority of people are so caught up in spending. I mean, I have had clients tell me time and time again, I had 15 questions, and they would only let me ask 3 because they didn't have the time to see me. Exactly.
Money.
And so, how are parents ever going to learn about this, the time it takes to find out, you talked about try this, vitamins and supplements and these kinds of things before you go, but who really takes that kind of time with people? And that's really the sad part of the whole thing. You have been watching What Wize Women Want here on Charlottesville's Public Access, Comcast Channel 13. I'm Dr. Brzezinski. Our panel today, talking about children and prescription drugs, has been Debbie Crosby-Louis, owner of DLC Image Consultants, and Carter Lewis, who's founder of RitalineAwareness.com, and Dr. Pamela Ross, who's founder and CEO of Holistic Medical Consultants. And ladies, I just want to say that this has been a real honor and pleasure to have all of you be so honest and so forthright in a topic that's really clouded an awful lot by people who are not really coming forward and talking about the kinds of things. And I hope that parents will be able to get informed in some small way. I mean, we can obviously talk about this for hours. There's so many, there's so many aspects of this. But I just wanted to say thank you so much for taking the time to be doing this program today and being so honest with us. And if you want to give us 30 seconds of a summary in any way to inform our parents or to say anything that you may think that you haven't covered, Pam, we'll start with you.
Well, I'll go back to my initial message. We're human beings and we have multiple components to who we are and how we exist. We are mind, we are body, we are spirit. And it's very important that we develop that not only within ourselves, but we work to teach that development to our children. And the greatest gift that we can give to our children is learning to love them for who they are. And that takes a lot of courage. That takes a lot of acceptance. But what our children need is our love and our attention. And pharmaceuticals do not fix that.
Carter?
I would like to encourage parents to go to RitalineAwareness.com. That's my website. There's a lot of information that we didn't get to today that deals with natural alternatives and biology. In my case, there were multiple things that played a role in certain behavioral problems, and that you can test for these things and resolve them naturally. And there's also genetic evidence that I should never have been on Ritalin to begin with. So there's a lot of information that we didn't get to discuss today. So if folks could go visit the website, that would be wonderful.
Debbie?
And very quickly, I have a very short thing to say to parents. Take the time. That's all. Just take the time.
Thank you.
Thank you.
Thank you.
Thank you.
And I would like to add to Pamela's, of course, being a psychologist, body, mind, spirit, and emotions, and keep them all in balance and help our children. Thank you so much for joining us, and we hope you will join us again for our next program. Have a wonderful evening.